All right, hello everyone. I am Tricia Brein. I'm a first-year resident here in Hendersonville, and I am here today to talk to everyone about how to help patients quit smoking and how to engage patients in a conversation and a dialogue about what works best for quitting smoking. So the way that I like to help people quit smoking is through the 5 A's approach, which are ask, advise, assess, assist, arrange. The first one being ask. That is where we as healthcare providers ask our patients about their tobacco use. This can be done in a couple different ways. One of the ways that we do it in our clinic actually is to have it in the electronic health record, and so it's just a checkbox. Then the next step is advise, which is really something that doctors know how to do, and we do a good job of it, because we can say, as your doctor, the best thing you can do for your health is to quit smoking. You can also say something like, as your doctor, I can tell you the best thing you can do for your breathing is to quit smoking. You can substitute heart disease, substitute broken bones, substitute your kid's ear infection, whatever it is that you need to do to target that patient visit, you can add that in there, fill in the blank. The next thing then that you can do is to assess someone's willingness to make a quit attempt. I know not everyone is willing to quit at any given time, but studies show that actually about half of smokers do want to quit. So it's really important that we ask about it. And so, the easy way, the easy out is to just say, hey, are you interested in quitting? And when someone says no, we just move on and forget that we ever asked them the question and sort of take a sigh of relief and say, good grief, now we don't have to go through that. But a better way to ask about it is to say something in an open-ended form where we say, what are your thoughts on quitting? And when you ask it in that way, you're more likely to get actual answers from patients. So if you say something like, what are your thoughts on quitting? Most of the time you're going to get people that say, oh geez, I have a lot of thoughts about quitting. I want to quit, but I don't really want to quit. And that's where you can go into motivational interviewing. You can ask about ambivalence, like tell me your thoughts on why you want to quit, why you don't want to quit, your ability to quit on a scale of 1 to 10. There's all sorts of things you can do with that. But really ask it in an open-ended way and have an honest dialogue with your patients about it. The next thing you can do then, after you've assessed them and their readiness to quit, you can assist. And this is something also that we're very good at, because we're the ones that prescribe the meds, but then also we know how to do it. We have the medical knowledge. So with the medications, of course, we can prescribe for the nicotine replacement or the bupropion or the varenicline, but then we also have an opportunity to say, hey, you know what? I'd love to talk to you about this. And doctors are great at helping people quit smoking. And people are 2 to 3 times more likely to quit if they have a doctor helping them. They're also much more likely to quit if they get some of that social support, which is also something that we can provide. We can also make referrals to behavioral health or quit smoking groups. So there's a lot of things that we can do as doctors to help our patients quit smoking. The next thing we do then is arrange for follow-up. Usually 2 weeks is an appropriate amount of time. So if someone says they're interested in quitting, and then you write them a script and you help them set a quit date, ask them to come back in 2 weeks to follow up just to make sure things are still going okay. If someone has fallen off the bandwagon, it's a great time to check back in and have them try again. And if someone has quit, it's a good time to come back and pat them on the back and congratulate them. So I also want to add a couple pearls with what I was just talking about with the 5 A's. One of them is really, as a doctor, your job is to be a cheerleader in this. And I know it's kind of silly, and I've talked about being an obnoxious optimist, but patients need to know that we can help them do this. Quitting is really hard, and they need to know that someone is on their side. And so it's just a great way to help them is to say, you know what? I know you've tried quitting in the past, and I know it's really hard, but you can do this, and we have tools that can make it easier. I know you've tried quitting 100 times before, but let's try again one more time. Let's give it an effort, and we're going to add medications, we're going to add the quit line, and we're going to add, whatever it is on top of it, and we're going to do it this time together. And really be optimistic for the patient, because they are probably feeling down because they've probably not been successful in the past, so they're really relying on you to provide that positive energy. Another thing is to share experiences that other patients have had with successes. So for example, if you've had a patient say that, I'm really concerned about gaining weight when I quit smoking, you can say something like, a lot of people who tell me that have had success with Wellbutrin or bupropion, because we know that people who use those are less likely to gain weight when they quit smoking. What are your thoughts on that? Women especially will say, I'm really worried about the weight gain issue, and we know that it doesn't always happen, and the medications can help. So just share successes from other patients. So another thing that you can do is just share funny anecdotes or funny stories that have been passed to you along the way. So one of my funny stories is I met a doctor colleague who told me the only thing that prevented him from smoking in the 80s was a bet that he made with his wife. Their bet was that they would both quit smoking, and they would put money in a jar, and at the end, after they'd been quit for a period of time, the person who smoked first would have to watch the spouse purchase something or do something fun without them. And so he said his wife wanted to buy this really ugly sweater, and he wanted a set of headphones. And he said that the only thing that kept him from smoking was the idea of his wife spending his hard-earned money on this really ugly sweater that she wanted. And so he stayed quit, she stayed quit, and they used the money to go on vacation together. So, just think of little things like that that you learn along the way that people can use as tips. Another thing just to keep in mind is that smokers often start smoking when they're kids, when they're teenagers really, before their brains are fully developed. And so just, cut smokers some slack, because it is an addiction and it's hard to quit. And a lot of adults now, because they started smoking when they were kids, they just haven't developed adult coping mechanisms that don't involve smoking. So for example, I had a woman tell me once that she didn't know how to drive a car without smoking in it, because she'd never driven a car without smoking in it. So she said as long as she could remember, she had pushed the cigarette lighter in and then turned the key. And when she quit smoking, she didn't realize how to turn the key without pushing the cigarette lighter in. And that was a huge change for her, to just take the cigarette lighter out of the car, because she'd never done it before. So if you just think about the everyday life of a smoker and how many of their habits and experiences and just daily routine revolves around smoking, it's really hard to ask someone to quit, because they just, their daily lives revolve around it. So just have some sympathy or empathy. Be willing to listen to people as they go through this struggle. Lastly, again, be a cheerleader and help people along the way. Keep coming back for more when people say they want to quit. Keep trying. Keep helping them. Thank you for watching. This is The Black Bag. This is Tricia Brein from the Hendersonville Family Medicine Residency Program.